Uganda, like many other countries, continues to face challenges posed by epidemic diseases. Illnesses such as Ebola, cholera, Marburg viral disease, COVID-19, malaria, and measles have been identified among the most dangerous diseases, claiming many lives and affecting communities across the country. Beyond the loss of lives, these epidemics can severely damage a country's economy, especially where health systems are weak and preparedness measures are limited. The impact is often widespread, affecting businesses, employment, trade, tourism, education, and government spending. During outbreaks, governments are forced to spend huge amounts of money on emergency health care, treatment centers, medicines, and disease control interventions. At the same time, businesses slow down or shut down completely, reducing productivity and affecting national income.
If there was a lockdown, people stop going to school. They lay us from our workspaces. They say, Etwina Center, you guys first go home when things stabilize, you come back. Those are missed opportunities.
To combat these challenges, civil society organizations, health workers, and health journalists convened to discuss epidemic preparedness and response strategies in the event of future outbreaks. The discussions focused on strengthening collaboration, improving community awareness, and enhancing accurate dissemination of health information.
There cannot have been a better time to invite journalists than now, when we are actually faced with the number of epidemic issues within the country. So we felt as Living Goods, it's a very good idea to update the journalists in terms of the way they collect their stories or report information on epidemic preparedness.
We are very grateful as the Health Journalist Network to be invited by the Living Goods for this training in this time of epidemics. We believe that we are going to be well equipped, as they've promised to give us a lot of resources and people who will help us to report better.
Health reporting remains a critical area in journalism, especially at a time when misinformation and disinformation surrounding disease outbreaks continue to spread rapidly. Experts noted that such trainings are important in equipping journalists with the skills and knowledge needed to report accurately, responsibly, and from an informed perspective during public health emergencies.
Reach out to anyone who has survived an epidemic. There are very many stories about COVID, people who survived COVID, right? There is something they bring to the table that relates with others.
Health experts revealed that despite previous outbreaks, significant progress has been made through government interventions. Community awareness campaigns and early preparedness programs have been strengthened as part of efforts to prevent and control the spread of epidemic diseases across the country.
Our community is very vigilant because this is not the first epidemic. We have been having a number of epidemics, coronavirus, and I think this time when you alert them, they're always actually responsive about the preventive measures of these epidemics. Preparedness, actually, like I said, it's not the first epidemic that we're encountering. Already we have the system, like at the district, we have the reporting system, we have the surveillance right from the district, the HSD level, the sub-county up to village level. We have the response team. We have the sample collection team that whenever there is a suspect, with all those signs, the sample can be taken and actually taken to the national laboratory for verification, whether it's a true case or it's not a true case.
Nagwija Serena for NSTV.